This is a video demonstration on a lower quarter screen. Perform a lower quarter screen on any patient with lumbar spine or lower quarter pain with areas of symptoms radiating into the groin or distal to the groin anteriorly, radiating distal to the gluteal fold posteriorly, and also perform on any patient with lumbar spine or lower quarter pain with complaints of weakness, numbness, or tingling.
Hi, so what we're going to be doing is a lower quarter screen today, and we are going to start with light touch. You want the patient to move as least as possible. So we're going to have them in supine first, and then move into pathological reflexes from light touch. So the first thing that you want to do is get consent from the patient and let them know what you're doing. So what I'm going to have you do is just remain laying down. I'm going to sight this cotton ball on different parts of your legs, and I want you to just tell me if it feels the same or different from what the light touch I'm about to give you on your face. Okay, so I'm just going to give you a baseline of what you should be feeling. Okay, and then I will briefly explain where each dermatome is. So, are you ready? Okay, so groin area would be L1. Medial thigh would be L2. Medial portion of the knee would be L3. You want to move from medial malleolus distally, and that is going to be L4. L5 is great toe. S1 is the back of the heel. S2 would be the back of the knee or the popliteal fossa. And you're just going to note any abnormalities. If they say that it feels different, then that would be an abnormality. And you want to compare bilaterally. You can also do 2-point discrimination, temperature, or pinprick for the same dermatomes. You can also further look into peripheral innervation if you suspect any abnormalities. And that would be it for light touch. Okay, so the next thing I'm going to do is assess pathological reflexes, and I can do this with the patient in supine again. We can start with Babinski. So I'm going to provide a little bit of pressure on the bottom of your foot with this, so I'll let you feel that. So that's all it's going to feel. Okay. Okay. So I'm just going to run this from the lateral portion of your foot to the great toe, and I'm going to look to see what her toes do in response. Okay. So normal would be flexion, and an abnormal response would be fanning of the toes or extension of the great toe. The next thing I'm going to do for pathological reflexes is clonus. So I'm going to first check her passive range of motion. I'm going to lift your foot to your face. Is that okay with you? Let me know if you have any pain with this, okay? So you want to do it passively and slowly to make sure you have enough range of motion. And then I'm going to go ahead and do the same thing, just a little bit quicker now. Okay. One more. Okay. So I'm looking for any beats. 2 to 3 is normal. Any more than that would be considered an abnormal response. And again, we're assessing for central lesions.
Okay, so now we're going to assess myotome, and the patient could be in seated or supine as long as they're not moving around too much. So we're going to perform this in the seated position. You're going to compare bilaterally, and then you gradually want to build your resistance to max so you can detect minimal changes in their myotome strength. Okay, so the first one will be L1, L2, which is hip flexion. So can you lift your knee up for me? All right, now don't let me move you. And then relax, and then can you kick your leg out? Okay, and then don't let me push you down. Good, and then, so that was L3, knee extension. L4, can you bring your foot up? Good, now don't let me push you down. Good, that's dorsiflexion. L5 is big toe extension, so can you bring your big toe up? All right, don't let me push you down. Good, and then S1 is plantar flexion. So go ahead and point your toes down. All right, don't let me pull your foot up. Good, and then, all right, and then S2 is knee flexion. So don't let me pull your leg straight, okay? And again, you compare that bilaterally and to assess their myotome strength.
So next up for the lower quarter screen, we have deep tendon reflexes. So there's two main deep tendon reflexes for the lower quarter. So you're gonna have the patellar reflex testing L3, L4, and then the Achilles reflex testing S1, S2. So this is gonna be used to determine whether or not the patient is normal, or if they have an upper motor neuron or lower motor neuron lesion. In upper motor neuron lesions, you're gonna have a hyperreflexive response. In lower motor neuron lesions, you're going to have a hyporeflexive response. So you're going to start off by having the patient in a seated position with the joint in a midline position, so the knee's at 90 degrees. It's not completely extended or flexed. And then when we move to the Achilles, the foot will be placed in a neutral position in between dorsiflexion and plantar flexion when we test that. So you're going to start off by palpating the patient's patella, and then just below that, you're going to feel for the tendon. And there it is right there, and I would say that is normal. So it's rated on a scale from 0 to 4 plus. 1 plus is, as I was, 0 is no response, 1 plus is a very light response, 2 plus is normal, 3 plus is brisk, and 4 plus is like a really exaggerated response. And 1 plus and 3 plus are also normal if they're the same bilaterally. And then you're going to test both of those reflexes on each side. So now I'll move to the Achilles. So I'm going to put the foot in a neutral position, and I would say that's normal, 2 plus as well. And then I would just compare that to the other lower extremity.